Hello everyone, this is Qing Liu. The topic I choose is West Nile virus. In the following presentation, I will introduce the West Nile virus as a public health problem, how this problem can be solved and finally be prevented from the public health perspective. About 80% of West Nile virus infected patients will not show any symptoms, but for the rest of 20% of them, they can experience fever, headache, muscle weakness, and body aches, nausea, vomiting, occasionally with a skin rash. Humans become infected simply through the bites of infected mosquitoes. Then how do mosquitoes get infected? The West Nile virus has long existed in the natural bird-mosquito transmission cycle. The horses can also be the virus hosts. West Nile virus is commonly found in Africa, Europe, the Middle East, North America, and West Asia. During summer and fall, which are two seasons that mosquitoes are the most active. Several factors can cause the spread of WNV. First, people who live near stagnant water fields have a higher risk to be infected. Secondly, since birds will maintain the virus, the presence of certain bird species can lead to viral amplification and transmission of WNV to mosquitoes. People in advanced age or having immune compromising have a higher risk of becoming ill severely after being affected. Regarding the future risk for community, global warming results in the increasing average temperature and rainfall in many regions, which facilitates the transmission of West Nile virus because the environment is suitable for mosquitoes to live and spread them to more new regions. Two strategies are commonly used during the outbreak of West Nile virus. The first one is adopting physical protection approaches. The second one is using active patient surveillance program. The first strategy, physical protection. Because no vaccine against the West Nile virus is available for humans, people living in the affected area are encouraged to wear long-sleeve clothes, use mosquito nets, drink the stagnant water, and apply mosquito spray at all doors. The second strategy, patient surveillance program. Because patients who are infected by West Nile virus often have clinical signs of viral encephalitis and meningitis, monitoring those patients and give them additional tests can help identify WNV infected patients. Here are two examples of how the WNV outbreak was solved in the past. The first example is how Europe dealt with the early onset of WNV case in 2018. The second example is the first WNV case in America, the outbreak in New York City in 1999. In 2018, the first WNV cases were notified by Greece in week 26, which was earlier than 2016 and 2017, in order to prevent the spread of WNV effectively. The European Center for Disease Prevention and Control updated maps of human WNV cases weekly to increase the awareness of the public. ECDC also promoted preventative approaches information, including wearing long sleeves and applying mosquito spray. When the outbreak of West Nile virus happened in New York City in 1999, hospitals in NYC were required to report any suspected cases of viral infections of the central nervous system and had them to receive additional examinations. The government used the patient surveillance program to identify 59 patients who were hospitalized with WNV infection in New York City area. After reviewing the literature, I organized some specific approaches we can do to prevent the recurrence of West Nile virus. New diagnosis methods are required in order to diagnose WNV-infected patients fast and accurately. Although there is no vaccine for humans against WNV, identify humans markers of immune susceptibility can provide an innovative treatment way. Finally, since climate change has influenced mosquitoes' activity pattern, it is necessary to include climate as a factor when deciding surveillance programs. Here, I will conclude my presentation by addressing some important tasks to be done when preventing WNV in the future. Based on my opinion, because WNV transmission cycle involves reservoir hosts, insect vector, accidental hosts. It is important to consider all the outbreak cases, both human and non-human, when designing the prevention programs. In my opinion, most people, even animals, are able to travel everywhere freely. In addition to climate actors, traveling population and migration should also be taken into account when predicting the outbreaks. Finally, those are references I used when research WNV. Thank you for your attention.